There are a couple of different cancers, in particular, certain blood cancers that have been shown to decrease in the presence of more metformin. The next thing I wanted to talk about was the concern that metformin was linked to cancer. This was an article from the AARP about metformin being recalled over a cancer risk. This is actually earlier this year, back in January of this year. And the idea was that, yes, a couple of batches of metformin were recalled because they contained a particular compound, N-nitrosodimethylamine, NDMA, which is a nitrosamine. There are a family of compounds called nitrosamines, which are related to cancer. And so many of them were recalled. The metformin in question, however, was the extended release metformin. Extended release metformin, as you can see right here, is a specific type of metformin that has a coating which allows it to break down over time. The recall was not extended to the immediate release form, which is the older version. The FDA has been monitoring this pretty closely for some time. And you can kind of see here, there have been several updates and press announcements about NDMA and metformin. And the reality is, there have been many companies that have suggested that voluntarily recalled their lots because of NDMA contamination. All of the testing that the FDA has done, as well as voluntary testing done by companies, as well as outside agencies, have not found NDMA in immediate release metformin. It's only found in the extended release. Of note, this doesn't just extend to metformin. There have been several different concerns about nitrosamine impurities in medications. So if you guys are on the following medications, ranitidine, rifampin, Chantix, or losartan, or some of the ARBs. Now, these are the blood pressure medications, valsartan, losartan, and irbesartan, that were under this recall. Of note, the one angiotensin II receptor blocker that I like, telmisartan, was not included in the recall. So if you just, something to think about, if you are currently taking these, or it's prescribed through your primary care physician, losartan, the extended release version of metformin, ranitidine, rifampin, or varenicline, which is Chantix, it might be a good idea to speak to your PCP about an alternative therapy. As I mentioned before, though, the immediate release version of metformin wasn't included in the recall and is perfectly safe. You might ask, though, why would you even use metformin? I mean, yeah, there's this concern about extended release, but what's the real reason why we use it? And I try to make sure that I mention this during appointments, but sometimes we go through a lot of things in patient appointments, and maybe I don't get enough time to really talk about it. The main reason I suggest individuals use metformin is because it's a really remarkable drug. There's been a lot of research on it in the anti-aging sphere because it really improves your insulin sensitivity. So it obviously reduces your risk for diabetes, but by virtue of this, it improves your ability to utilize fatty acids, right? Fatty acid oxidation for fuel. And it also works on the mTOR protein pathway, and specifically mTORC1, that particular protein pathway, which is really associated with cellular longevity. There's a lot of research being done on that. That particular protein pathway is associated with cellular lifespan, right? And if you're able to block it, you can radically increase how long your cells live. And this is not just specific to certain cell lines, it's specific to all cell lines. It does reduce free radical formation. I've mentioned this multiple times, that free radical formation is something we want to really try to reduce. That, of course, can lead to a lot of cellular damage and organelle damage, the portions of the cell, the nucleus, the mitochondria. It has been shown to reduce cancer growth. There are a couple of different cancers, in particular, certain blood cancers, that have been shown to decrease in the presence of more metformin. It modulates the gut microbiome. One thing I mentioned to patients is that initially when you take metformin, you may notice GI disturbances. That's usually due to candida die-off, so yeast die-off, which is a good thing. because you don't want yeast in your gut. You want bifidobacterium, you want lactobacillus, you want Saccharomyces, you want the other really healthy bacteria, but you don't want yeast. And that is probably one of the reasons why we get a little bit of gut distress with metformin. This is limited and goes away after, in many cases, a week or two, but in most cases within a month. And usually, if you start out with a lower dose, like maybe a half tablet or so, it's not quite as bad. The other thing that is kind of interesting is it appears to, in certain individuals, restore ovulation. Now, it's been used in females who have polycystic ovarian syndrome, but it has been shown to restore ovulation in certain individuals like that and improve fertility. And so those would be the main reasons why I'd suggest you take it. And if anyone is interested in this, I'm more than happy to send over some articles and help them better understand why I think metformin is a great drug.